Hello, I'm Dr. John Petrick, the Clinic Director for the Las Vegas Pain Relief Center. Today I'm going to be demonstrating a technique called the cranial facial release. Now, craniofacial release technique was designed to optimize brain function and to help patients who are suffering from sleep apnea, migraine headaches, TMJ syndrome, and various other types of disturbances of the face and neck. The uniqueness of the craniofacial release is that we insert a balloon into the nasal passages, inflate the balloon, and then remove the balloon once it's deflated. As I explained to you in the office today, the skull is made up of 22 individual bones with 64 articulations. When the skull bones and the articulations are impeded or there's a problem, they start to stick and they adhere, much like we do with the soft tissue components of the other active release treatments that we do. I'm going to be taking a small little tiny little finger cot and I'm going to be inserting it into the nasal passages. Then I'm going to inflate it and then I'm going to deflate it in about milliseconds. Okay, it doesn't take long to deflate it. What it's going to do is it's going to fix your deviated septum. It's going to allow you to breathe, and if you are having problems with sleep apnea and snoring that we had talked about, this will help correct. Now, if I can take a look at your nose, and when I have you look straight ahead for me, I want you to look at the deviation to the nose as nose goes to the right. If you also look at the nose, there's a skinny nasal passages in here. So Stan has a nose that's going to the right, meaning that his deviation is to the left. I don't know for sure, but my guess and my experience would be that even though the deviation's to the right, he's going to have trouble breathing through the left side of his nostril. Stan, which side of the face do you typically have a problem? So good? Can't breathe through the left side, right?
That's it.
Okay. How long have you not been able to breathe through the left side of your nose?
Oh, probably 15, 20 years.
15,
a long
20
time.
years, a long time, okay?
Since
and
my athletic days.
Your biggest concern has been snoring and not possibly getting enough rest, and you can notice a definite change.
I don't get enough rest.
And this is a great picture from where my angle is, because you can actually see that perfect deviation to the right, and you can see that narrow passage right there, and it's kind of bulbous right through there. So what's happened is his body's kind of compensating for the lack of breathing ability on the left side by expanding the right side. He actually can probably expand the right nostril more than the left. It's something to consider when you're dealing with sleep apnea, that the biggest component is the nasal passages. So the first component that we look for when fixing sleep apnea or snoring is the cranial vault or the cranial passages. So what I'm going to do is ask you to go ahead and just relax for me, Stan, as I inject this into the nostril, and you're going to feel it go in. And I'm going in, I'm not going up. A lot of times people want to they want to kind of put something up the nose, but actually it's in the face, it's not in the nose. So the face goes this way. So it's actually all the way in right now. So good, and that's as far as we're going to go, right there. Good. So we're there, Stan, okay? So we're already in there right now. There's no problem. And are you uncomfortable right now? It's just a little uncomfortable. No pain, right?
A little unusual.
Unusual, right? But no pain, correct?
No.
Okay. I'm going to lock this down. Good. Okay, and I'm just going to walk you through this one more time. Again, this is craniofacial release. It's designed to optimize brain function and then fix the deviated septum which you have and help you with your snoring and sleep apnea. When you take a deep breath, you're going to go at the same time, bring your toes to your nose. As soon as your lips close, I'm going to, just like that. And as soon as you close your mouth, I'm going to inflate the balloon, and then I'm going to unflate the balloon, okay? If it's too uncomfortable, I just want you to raise your hand. You do not have to do anything else, okay? All right, I'm going to go ahead and close it all down. I'm going to cover the left nostril, okay, just like so. Good, and then you go ahead and take on, when you're ready, and just look straight at me, and when you're ready, you just take a deep breath in, bring your toes up, and I'm going to pop away. Good. And for those of you who didn't hear it, you heard the cracking, and you felt the cracking in the skull, correct? Okay. Are you uncomfortable right now? Was there any pain?
No.
No pain. Pressure, like you did when you were in the pool, and you got water smashed up your nose. So now, this is the left side. So left to the floor. Good. And I'm going to go in this passage and then into the nasal cavity here. Now, because this one's narrow, and I'm going to pull that back up. Because this one's the one that's actually a little bit shorter, Sorry, bud. We're gonna go, I gotta get up into that middle sinus there. So I gotta go up and then down. And it's definitely, he's definitely occluded here. And he's blocked. Good, let's pull that out and reinsert. He's got an occlusion in there, so it makes it a little difficult. Sometimes you bump up against that actual deviation. We got to go for it. So I'm going to ask you just to kind of bear with me here. And we're going to go right in there, and we're going to go more medial, and we're almost all the way in. Yeah, you can feel the deviation on this one, pal, so it's a little...
Oh, yeah.
Okay. Good. Excellent job, Stan. Absolutely wonderful. Good. I'm going to lock the balloon down. Good. And I'm going to take a little bit of a hold on it right there, pal. And I'm going to hold this nostril shut too, okay? So I'm going to block the balloon down. It's ready to go when you are. So you take a deep breath in and just say, ouch, when we're ready. I'm kidding. Just go ahead and go.
Whew.
Okay, that is all that we're going to do for that particular movement right there. Good, and that's cranial facial release. What I'm going to do is I'm going to have you turn on the other side for me, Stan. Good. Stan, was there any pain really associated with that?
I wouldn't call it pain.
bit of
Significant,
discomfort.
more discomfort on the left side than on the right.
On the right side.
Like you
Again, that's the
explained.
side that's ultimately the deviated side.
Right.
Can I get you to take a nice deep breath in? Do you notice a difference?
Oh, major difference.
Major difference, right?
Major difference.
Major difference. So I'm going to ask you to do one more thing, Stan.
Okay.
And this, I'm going to give you something to smell. Okay, and I want you to notice now, some of the side effects to this are increase smell. Your senses come back. Increase, believe it or not, we're freeing up the cranial vault, so the occipital lobe in the back of the head is being adjusted by this as well. So a lot of times your visual acuity, because it's kind of nighttime and you're leaving and going home, you may notice the street signs a little bit better. I know that sounds a little funny, but you're going to be getting more oxygen to the brain, which is awesome. It's the number one thing we can do to
My wife
ourselves.
will think so.
Your wife is going to think so. So this is done in a series of 4 treatments. We start with the lower right, the middle left, then we go to the middle right, to the upper left, and then upper right, lower left. I know it's not too important, but we're only doing 2 sinuses per day. We do three different sinuses, and then on the 4th day we do the major blockage, which I'd probably hit that middle one that we did on you. I would hit that one again, that major one, on your 4th visit. So these treatments are done in a series of 4 visits, and that's the cranial facial release protocol. Okay? So go ahead and take a nice deep breath. Yeah, take a nice deep breath through your nose. Just breathe that in. Good. Now the other side. It's profoundly different.
Oh, way different.
Do you notice a difference in the ability to breathe, correct? Excellent. Okay, thank you very much. That's all that I'm going to do.
Thanks, guys.